What are anxiety disorders? Anxiety disorders are a group of mental health conditions characterized by excessive fear, worry, or nervousness that interferes with daily life. While some anxiety is normal and even helpful in certain situations, like avoiding danger, anxiety disorders involve persistent, overwhelming anxiety that is often irrational and difficult to control. Generalized anxiety disorder, GAD, characterized by chronic and excessive worry about various aspects of life, work, health, relationships, etc. Worry is difficult to control and is often accompanied by physical symptoms. Panic disorder involves sudden, recurrent panic attacks, intense episodes of fear or discomfort with symptoms like heart palpitations, chest pain, dizziness, or fear of dying. People may live in fear of the next attack, which can lead to avoidance behavior. Social anxiety disorder, social phobia, extreme fear of being judged, embarrassed, or humiliated in social or performance situations. Can lead to avoidance of social interaction and isolation. Specific phobias. Intense, irrational fear of a specific object or situation, e.g., heights, spiders, flying. The fear often leads to avoidance that interferes with daily functioning. Agoraphobia. Fear of being in places or situations where escape might be difficult or help unavailable during a panic attack. People may avoid public transportation, open spaces, crowds, or even leaving home. Separation anxiety disorder, most common in children, but can affect adults. Excessive fear or anxiety about separation from attachment figures. Selective mutism, a rare disorder where a person, usually a child, consistently fails to speak in certain social situations despite speaking in others. Anxiety disorders are caused by a combination of biological, psychological, and environmental factors, genetics, family history of anxiety or other mental health disorders. Brain chemistry, imbalances in neurotransmitters like serotonin, dopamine, and GABA. Personality, traits like shyness or behavioral inhibition. Trauma or stress, childhood abuse, neglect, death of a loved one, or major life changes. Substance use, drugs or alcohol can trigger or worsen anxiety symptoms. Medical conditions, heart disease, diabetes, thyroid problems, or chronic pain may contribute. Excessive worry or fear, restlessness or feeling on edge. Irritability, muscle tension, fatigue, difficulty concentrating, sleep disturbances, panic attacks, sweating, trembling, chest pain, dizziness, rapid heartbeat, avoidance behaviors. Questionnaires or self-report tools. Criteria from the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. A proper diagnosis requires the symptoms to be persistent, typically lasting 6 months or more, cause significant distress or impairment in daily functioning. Anxiety disorders are treatable with a combination of therapy, medication, and lifestyle changes. 1. Psychotherapy. Cognitive behavioral therapy, CBT, the most effective approach, helps patients identify, challenge, and change negative thought patterns. Exposure therapy gradually exposes patients to feared situations to reduce avoidance and fear. Acceptance and commitment therapy, ACT, focuses on accepting anxiety and committing to meaningful actions. 2. Medications. SSRIs, selective serotonin reuptake inhibitors, e.g., sertraline, fluoxetine. SNRIs, serotonin norepinephrine reuptake inhibitors, e.g., venlafaxine. Benzodiazepines, e.g., diazepam or lorazepam, used short-term due to addiction risk. Beta blockers, help with physical symptoms like trembling or rapid heartbeat. Buspirone, specifically for GAD, non-addictive. 3. Lifestyle and self-help, regular exercise, healthy diet, stress management techniques, yoga, meditation, breathing exercises, sleep hygiene. Reducing caffeine or alcohol. Anxiety disorders are the most common mental health condition worldwide. Affect over 30% of adults at some point in their lives. Often co-occur with depression or substance use disorders. Can severely impact relationships, work, education, and physical health if untreated. If anxiety is persistent, overwhelming, and interfering with daily life, professional help should be sought. Early intervention improves recovery and quality of life. What are mood disorders? Mood disorders, also known as affective disorders, are a category of mental health conditions characterized by disturbances in a person's emotional state. These disturbances involve prolonged and intense episodes of sadness, depression, elevated mood, mania, or a combination of both. The changes in mood can disrupt daily functioning, relationships, work, and physical health. 1. Major depressive disorder, MDD, also called clinical depression or unipolar depression. Characterized by a persistent and intense feeling of sadness, hopelessness, and loss of interest or pleasure in most activities. Symptoms must last at least 2 weeks. 2. Persistent depressive disorder, dysthymia, a chronic form of depression with less severe symptoms than MDD but lasting for at least 2 years. Individuals may be functional but feel continuously low or fatigued. 3. Bipolar I disorder, characterized by at least one manic episode, which may be followed by depressive episodes. Mania includes elevated or irritable mood, inflated self-esteem, decreased need for sleep, and impulsive behavior. 4. Bipolar II disorder involves hypomanic episodes, less intense than mania, and major depressive episodes. People with bipolar II typically do not experience full-blown manic episodes. 5. Cyclothymic disorder involves chronic fluctuations between mild depressive and hypomanic symptoms for at least 2 years, 1 year in children. Symptoms don't meet full criteria for MDD or mania but are still disruptive. 6. Seasonal affective disorder, SAD, a type of depression that occurs seasonally, typically in the winter months due to lack of sunlight. Symptoms improve with the return of sunlight or through light therapy. 7. Disruptive mood dysregulation disorder, DMDD, diagnosed in children and adolescents. Characterized by severe, recurrent temper outbursts and chronic irritability or angry mood. 8. Premenstrual dysphoric disorder, PMDD, a severe form of premenstrual syndrome, PMS, with intense emotional and physical symptoms that occur before menstruation. Includes depression, mood swings, anger, and anxiety. Mood disorders arise from a complex interaction of biological, psychological, and environmental factors. Genetics, family history significantly increases risk. Brain chemistry, imbalances in neurotransmitters like serotonin, dopamine, norepinephrine. Hormonal changes, thyroid disorders, pregnancy, menopause. Personality traits, low self-esteem, pessimism, high stress sensitivity. Cognitive distortions, negative thinking patterns. Trauma or abuse, chronic stress or loss, divorce, job loss, death of a loved one, substance abuse. Lack of social support. The symptoms of mood disorders vary depending on the type, but common signs include persistent sadness or emptiness, loss of interest in activities, fatigue or low energy, changes in sleep, insomnia or oversleeping, appetite or weight changes, feelings of guilt or worthlessness, difficulty concentrating, suicidal thoughts or behaviors, elevated or irritable mood, inflated self-esteem or grandiosity, decreased need for sleep, increased talkativeness, racing thoughts, distractibility, risky behavior, e.g., spending sprees, reckless driving, sexual risk-taking. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after a person experiences or witnesses a traumatic event, such as war, assault, natural disasters, or serious accidents. It is characterized by intense, disturbing thoughts and feelings related to the trauma that persist long after the event has ended. Re-experiencing the trauma through flashbacks, nightmares, or intrusive thoughts. Avoidance of places, people, or activities that remind the person of the trauma. Negative changes in mood or thinking, such as guilt, shame, or detachment from others. Hyperarousal, including being easily startled, feeling tense, trouble sleeping, or angry outbursts. Experiencing or witnessing trauma. Lack of social support. History of mental illness. Childhood abuse or neglect. Diagnosed by mental health professionals using DSM-5 criteria. Treatment includes psychotherapy, especially cognitive behavioral therapy, CBT, and EMDR, eye movement desensitization and reprocessing, medications like SSRIs, e.g., sertraline, paroxetine, support groups and self-care strategies. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may appear to have lost touch with reality, which can cause significant distress and problems in daily functioning. Positive symptoms, added experiences, hallucinations, seeing or hearing things that aren't there, delusions, false beliefs, such as thinking others are out to harm them, disorganized speech and thinking, unusual or erratic behaviors, Negative symptoms, reduction or loss of normal functions, lack of emotion or facial expression. Reduced motivation, social withdrawal, difficulty speaking or expressing thoughts. Cognitive symptoms, poor concentration, memory problems, difficulty with decision-making and problem-solving. Genetics, family history of schizophrenia, brain chemistry, dopamine and glutamate imbalance, brain structure differences. Prenatal complications or early childhood trauma. Drug use, especially in adolescence, diagnosed through clinical evaluation and DSM-5 criteria. No cure, but symptoms can be managed with antipsychotic medications. Psychotherapy, supportive services, housing, education, vocational support, family and community support. Obsessive-compulsive disorder, OCD, is a chronic mental health condition characterized by obsessions, unwanted, intrusive thoughts, images, or urges, and compulsions, repetitive behaviors or mental acts performed to reduce anxiety caused by the obsessions. Obsessions, recurrent, persistent thoughts such as fear of germs, harm, or losing control. Compulsions, actions like excessive hand-washing, checking, counting, or repeating words, done to relieve anxiety or prevent a feared event. Genetics, family history of OCD, brain chemistry and structure, especially serotonin imbalance, childhood trauma or stress. Personality traits like perfectionism or high anxiety. Eating disorders are serious mental health conditions that involve disturbed eating behaviors, thoughts, and emotions related to food, body weight, and body image. They can lead to severe physical and psychological health problems, and in extreme cases, can be life-threatening. Anorexia nervosa, intense fear of gaining weight. Severe food restriction and weight loss. Distorted body image and denial of thinness. Bulimia nervosa, episodes of binge eating followed by purging, vomiting, laxatives, excessive exercise, feelings of shame, guilt, and loss of control. Binge eating disorder, BED, frequent episodes of eating large amounts of food without purging. Often leads to obesity and related health issues. Avoidant, restrictive food intake disorder, ARFID, extreme avoidance of certain foods, often without body image concerns. Can lead to nutritional deficiencies and growth issues, especially in children, genetics and family history. Psychological factors, low self-esteem, trauma, anxiety, cultural and social pressures around body image. Dieting or excessive focus on weight.